Good afternoon. Welcome to day 249 at the EMA office, where we bring you the latest in the numbers for the COVID, here with the Chairman Kern and Sam Bierman from the St. Clair County Health Department. And Sam, you have our daily report.
I do, and our numbers, again, not looking so great today. So as of today, we have tested 136,682 St. Clair County residents, which is an increase of 1,055 from yesterday. We have 12,085 positive test results, which is an increase of 234 from yesterday. And that it does include both males and females from under the age of 1 up to their 90s. Today, our daily county positivity rate is 22.2%. And we are at 124,597 negative test results. Unfortunately, we are announcing an additional death, which does bring our total for St. Clair County to 238. That was a male in his 60s who had unknown health conditions. And as always, our sympathies go out to his family. For those who have completed the IDPH required 10-day isolation period, we are at 9,896. For state totals, 9,255,658 have been tested, with 597,849 positive test results, which is an increase of 10,875 from yesterday. And for deaths, the state is reporting 10,875, which is an increase of 97 from yesterday. For St. Clair County hospitalization numbers, currently we have 97 individuals that are admitted due to COVID-related reasons, and 12 of them are on ventilators. Regionally, we have 205 individuals that are admitted due to COVID-related reasons, and 23 of them are on ventilators. For our congregate living centers and long-term care facilities that are currently or previously in outbreak status, these are cumulative numbers, and we will only announce any facilities that have changed. Caritas Family Solutions in Belleville has 53 cases and no deaths, and that is an increase of 10 cases for that facility. Caseyville Nursing and Rehab has 51 cases and 2 deaths, and that is an increase of 1 case for that facility. Morningside of Shiloh has 3 cases and 1 death. And I need to make one clarification. We had those results, and we were only aware of 1 individual that was attributed to Morningside of Shiloh. We learned today that 2 others that we had already been counting in the results were related to Morningside of Shiloh, so that's why we're making that correction. So they are at 3 cases and 1 death. And now I will turn it over to Chairman Kern for his update.
Thank you, Sam. So we'll move into the zip code report. We're going to have a little bit of an extended briefing today because the governor announced and Illinois Department of Public Health announced new mitigations that will take effect this Friday. So we'll be talking about those. But first, let's move into the zip code report and see the COVID positive changes in St. Clair County. In 62059, we went up 1 to 21. 62201, we went up 4 to 344. 62203, up 2 to 345. 62204, up 3 to 210. 62205, up 5 to 310. 62206, up 7 to 613. 62208, up 19 today to 701. 62220, up 12 to 874. 62221 went up 21 to 1120. 62223, up 15 to 769. 62226 went up 17 to 1277. 62232 went up by 11 today to 341. 62240, up 1 to 62. 62243, up 4 to 234. 62254, up 4 to 393. 62255, up 1 to 25. 62257, up 2 to 84. 62258, up 13 to 406. 62260, up 2 to 280. 62269, up 26 to 1116. and 62285 up 6 to 240. Our daily county positivity today is 22.2%. 234 new COVID positives with 1,055 tests. That's where 22.2% comes from. And that brings our 7-day rolling average to 15.3%. These percentages are going to become very important when we start looking at the new mitigations in a couple minutes, because if we're going to get back to where we were, there are new metrics we have to follow to get back to the Tier 2 status. The state, which is the number they pay attention to, has our regional positivity pegged at 16.1% today, and actually that went down a little bit. That's a good thing. But they derived that from Bond County being at 34.8%, Clinton County at 19.9%, Madison County at 20.5%, Monroe County at 24.3%, Randolph County at 14.0%, St. Clair County is at 18.2%, and Washington County is the highest at 40% today. So because of all this and because of surging numbers throughout the state, the governor announced Tier 3 resurgence mitigations today. Herb?
Yes, had a quite lengthy presentation he did today, him and Dr. Ezike, and we have posted those mitigations out to all of the local community leaders, and it's going to up on our website. A lot of it, you've got a list of them there, what they're going to be doing. So I think it's worth us telling our viewers.
The governor and the Department of Public Health, along with the medical community, I think went to a lot of work. This is the most detailed resurgence mitigation that we've ever seen. The governor made the point that rather than just a total stay-at-home order, they thought that this was a good step to try to get the numbers curbed, that they're going up right now, they're spiking, and they're going to try to bend this curve with these particular mitigations. So we'll start with what many people are interested in, the bars and restaurants. And remember, order that takeout. You know, when you're thinking about your favorite restaurants, make sure that you give them business. They need that right now. That not only for the people who own those businesses, but for the people that work there, the servers, the cooks, the chefs that are part of that those entities. They need help. So maybe you order a little more than you normally would, and a little more frequently than you normally would. All bars and restaurants under this mitigation will close at 11 p.m. and they can't open any earlier than 6 a.m. Continue to have no indoor service. There are many. I'm just going to go through and give some of the changes that we see. But I think the big change is that indoor gaming terminals are going to suspend operations, and this all takes effect Friday, November 20th at 12:01 a.m. And this includes private clubs and country clubs. So health and fitness centers are also going to be affected. There's some new rules that are going along with that, including face coverings must be worn at all times, and there will be no indoor group classes. Hotels have some new restrictions. Manufacturing has new restrictions, and those are listed on the site. Basically, what they're trying to tell everyone is they really want to limit gatherings and social gatherings to household members, and those are really in-home gatherings. Meeting rooms, banquet centers, country clubs may not host gatherings. No party buses. Funerals will be limited to 10 family members of the decedents, and that doesn't include staff, but really it's family at funerals. And all employees who can work remotely should work remotely in the office, and of course that's how the courthouse is operating now. Personal care service, you'll still be able to get your hair cut. It's just that you got to wear a mask. So any places where you can wear a mask and get those services and keep it on, then they will still be allowed to operate. Of course, if you have to take your mask off to get your beard trimmed or your mustache trimmed, that isn't allowed. And so they're really focusing on wearing these masks, and the face coverings are really the key to the whole situation. Retail is going to operate at no more than 25% capacity. Grocery stores and pharmacies can operate at 50% capacity, but they're really encouraging delivery and curbside services where possible. And they're encouraging just shop smart. So try to keep your in-store shopping that your trips are efficient, and that you've got a list, and that you don't go back multiple times a week if you can avoid it. And try to keep those to a minimum. And to get back to Tier 2 mitigations, a region must experience less than 12% 7-day average test positivity rate for 3 consecutive days, and a greater than 20% available intensive care unit. So those ICU numbers, the hospital bed numbers, have to get much better than what they are now. And you have to have a 7-day average COVID hospitalization declining for 7 out of the last 10 days. So we've got a ways to go to get to those mitigations, but they are not unattainable. If we all work together on this, we can get there. The secret is wear the mask, wash the hands, watch the social distance, follow these resurgence mitigations, and we'll all get there.
Well, and I think it's, Dr. Ezeke said it the best. There was a question proposed to her today. Why not just a total lockdown, shutdown? And she got very voiceful. You're darned if you do and darned if you don't. And we've seen that here on our briefings. We have Team St. Clair that is out there supporting each and everything every day, following us, spreading the word. And then there is still that percentage of the people that still believe this is nothing but the common cold, the flu. We talk about the hospitalizations, and last night there was a lot of questions asked about hospital, how many beds there are. We don't have all that information. All we know is what we receive. But I just wish that those of you who are asking those questions take that COVID equation out of it for just a little bit. We're not just talking about hospitalization for COVID patients. Think about your parents, your grandparents. They start having those chest pains. The diabetics have a reaction. They end up having to go to the hospital. You may not have a bed there for those type of illnesses or injuries. That's what we're talking about in hospitalizations. They are overrun with COVID patients. And some of you say, no, there's not. There was a person on there last night saying, well, I know for a fact that this hospital's got this many beds. And we talk about it all the time. They may have a physical bed there, but they don't have the personnel to take care of that patient who may end up in there. So please, just use a little bit of that reasoning when you come to that.
This is real, and if those people are still out there trying to deny it, they're just wrong. And so it's time to move on from them. These are well thought out mitigations. They've talked to a lot of people. They have all the contact tracing that we do. They have all of those numbers. They can really kind of gear down to see where the problems are. I heard on the radio today that they're even using credit card receipts to know where in the states where we have high positivity rates, where people are spending their money, to see how that equates to high positivity rates. I mean, the scientists are looking at this, the statisticians are looking at this, and the whole goal is, let's get these numbers down, let's save some lives. Once we get the vaccine, we can get back to normal, but until that time, we've just got to hunker down and get through what appears to be the winter. Hopefully, we're out of Tier 3 more sooner than later, but it's going to be a while until we get these numbers turned around, because they have spiked to a point where it is going to take time to get them down. You look today, 36 of the COVID positives were teenagers, or those under 10 years old. So my son's going to be coming home from college. They are saying once your child comes home, or my son is an adult, but they're going to stay home, because they want the learning then to become remote after Thanksgiving. I certainly hope that the schools in the area adopt that. It seems to make a lot of sense that once we get home for Thanksgiving, some people may still not get it, that they've got to keep strangers, even though it's family. There are people you haven't been with, and spread happens. It may not be intentional, and the problem with this virus is that it allows you to spread it, not intentionally. You just spread it because you've got it and you're asymptomatic, and you go to a place and you think, I don't have it. You never would intentionally give this to another family member or a friend, but it happens. And it's obviously happening far too often because our numbers now are above 16%. Today's number was 22.2% in St. Clair County alone, a number that we haven't seen since April.
A long time. Another number we're looking at under the age of 40, 108 of those cases. Again, it just shows that this virus doesn't care how old you are, doesn't care where you live, doesn't care where you work. It's there, as the chairman said. It can affect anybody at any time, and it's our job. Like Dr. Ezekiel said today, we need to take this pause for just a little while longer, hopefully. Otherwise, if it would get to another to a lockdown situation, nobody's going to be happy about that. As she said, there's not going to be people happy about this, but I think it's really a well-thought mitigation plan, and it's up to each and every one of us just to get behind it and support it, and then we can say that this is behind us, the vaccine gets here. That's going to be another big hurdle like we've talked about, but we can do it. I really do. For 249 days we've been doing it.
And it's issued statewide, so although the mitigations now are statewide, really our future is in our own hands. We can move back to the Tier 2 mitigations just in this region. It isn't that the whole state has to get to meet those metrics that we talked about. It can just be our region, and then we'll get to move back to where we want, and hopefully then beyond that to where we were in September.
Well, and another death today in the county alone. It's 238 lives that we've lost here in 249 days. Just for those of you who always do your math every night, just take and think what that is. 238 of our county residents that aren't here to help us with this, aren't going to be here to help make these decisions, and furthermore, aren't going to be with us on the holidays in the future. So please, let's continue to work together. These mitigations will be posted up on the EMA site, and take a look at them. Voice your concern if you want to. I know Team St. Clair will do that. They're 100% trying to help us get this word out, and you've been a big part of this, and we just need you to help us put the brakes on these numbers by spreading this word. We'll be back with Daisy in just a few moments to translate this into our Spanish communities, and we'll be back tomorrow with day 250, and hopefully with some better numbers. Thank you.
One of the ways we can combat widespread infection is testing. It's been proven time and time again that many people who were infected with COVID-19 are asymptomatic, showing no signs of infection. They unknowingly spread the virus to those most vulnerable in our community. Working together with health departments in our region, free testing has been made available throughout the area, and we encourage all citizens and visitors to take advantage of this opportunity. To Team St. Clair and the rest of Region 4, if we work together, we can and will stop the spread of COVID-19.